is what it looks like. We have a glucometry meter. We've got the test strips. We've got the lancets that poke. There's different style lancets. There's these other couple of styles here, which you grab the purple tip, you twist and you pull it out, and then you put the flat purple thing on the skin and you push the button and the needle goes in and out, retracts, and then that goes into a sharps container. Yes?
Will all of the lancets have like the adjustable, so kind of depending on like for a baby as opposed to somebody with like callus fingers, like the size for the...
Yeah, I don't know if this one has any adjustability. It just kind of goes in a little bit.
Okay.
I don't know if the skin varies that much between the adult and the child. I'm not sure it does a little bit, but yeah, I don't think it does.
I've used the purple ones before, and those ones should, if it's the same that I've used, so I just wasn't sure.
This one does have a little twist where you can, I think you can adjust that, right? Mm-hmm. The others, this does not.
Okay, I was just curious.
So this one, you pull the plastic piece off, the blue piece is there, and when you push the blue piece against the skin, it pushes in and you hear pop, and then you just throw that away. The needle pops out, retracts back in, it's covered, and you can throw it, really, it could probably go in the garbage, but we've been throwing it in the sharps container, which is this red one or that red one. What I've done so far is I've tested someone. I could have someone come up and I can either actually test your blood as a demo, or we can almost test it and just have you go through, I can go through everything except poking and drawing blood. Do we want to do that now?
Yeah.
Yeah.
Okay, good. So let's go through the motions. I just need somebody, even if we're not actually poking you, because you'll do that in a minute anyway. I've been poked. I did it the first time this morning. I was the guinea pig. Had someone take mine, and then I did it again because one group only had 5 people, so I was the guinea pig on that one as well. So you're going to make patient contact. You're going to do all the things that you do to determine sick, not sick. You know, you're going to determine that their level of consciousness is altered, and whether they have diabetes history or not, stroke history or not, I still need to check. If they're unconscious, I still need to check, because I don't know why they're unconscious. Yeah, they fell, but it's nice to get a sugar on those people too. But typically on a trauma patient, the medics will start an IV. They'll take the needle out, the catheter stays in, the plastic flexible tube stays in, it gets secured, the needle comes off, goes into the sharps, the little plastic piece that holds the needle, we put the test strip right up to it, and there's blood on it, and we take a test of that on a trauma patient, just to get an FY. Like if somebody crashed their car, and they're like, we think they're drunk, but we want to make sure, well, we test their blood and it's 29. Okay, well they're probably low on sugar, that's why they crashed their car. Just an FYI. Okay. So I'm going to get everything set before we do anything. Use the table. I'm going to get my Band-Aid out, my alcohol swab, the lancet, and a test strip. I'll get more of these test strips in here in a minute. And I'll take this out. You can leave the glucometer in the case, but sometimes blood drips into the case if you're moving it around. So whatever, you can take it out or leave it in. So what I'm gonna do is open the Band-Aid pack, get that dude ready. Why don't you scoot over there so everybody can see, and then when we're ready to start, I'll have you roll forward. Oops, start taking the Band-Aid's coming apart a little bit there. Band-Aid's out. I'm gonna open this. Tear down the side, move it over. And if you look at the test strip, the top of it's blue and the bottom of it's all white. There's nothing on the bottom, it's just white. The top of it is is blue, and it's got these little bars, these black bars. They go into the machine upright, and then the white tip there, that's where the blood goes on at the end. And you need to get enough blood on it the first time. If you don't quite get enough blood, it's not going to beep at you. And then you want to get right, you want to stay there until you hear the beep. Keep pushing blood until it soaks up. If you stop for more than about 5 seconds and you try to get more blood, it will kind of coagulate up inside there, and you'll have to repeat and do it over again. So that's why we want to do it right the first time. So when you are, once you poke them, you want to, what we call kind of, milk it out, get the blood out as much as you can. So if the hand's up like this, you can already feel the pressure of the hand is not as high as when it's below the heart. So the hand's down here, outside of the ring finger, it's kind of the most recommended. You can use the index, but most people use their index finger more for working and stuff. So outside of the ring finger on the end, and once you poke it, you can set the lancet down for now. It's already retracted, so it's not going to hurt anybody. And you want to kind of milk this way. You squeeze upstream, and on the other side, it's kind of at the same time to push blood out. When you squeeze, let go, squeeze, let go. When you let go, it lets more blood come down, and you push it out. And you kind of keep doing that over and over until you feel like there's enough blood, a big enough droplet of blood to make it work. You want to really make that happen before you pick this up and start drawing, because once you start putting blood on there, if there's not enough, well, you're probably going to have to repeat it. Okay, so who wants to be my guinea pig? So Casey's back up here for more. Okay, so I'm putting the black bars in on the side with the buttons. The yellow tab slides right in like this. I don't have to touch anything. As soon as I put the bars in, it automatically turns the machine on, and you see what do you see? A little droplet going on the end of the test strip. That kind of tells you it's all ready to roll, right? Okay, so it's ready to go.
Is it for your last group, just so you know?
For last
Thank
group,
you, sir.
thank you very much. I've got the Band-Aid ready. I'm going to get my alcohol swab ready to go. And I'm using his ring finger outside. I'll just do the whole thing. I want to do this and just let it dry up a bit before we start. Okay, just let that air dry. I'll put this over here in case we need it again. I can get out another one if we need it as well. Everything's ready. And when that feels like, you can blow on it if you want to help. Or does it feel like it's pretty dry?
Yeah.
Okay, that's pretty much dry. Take this off. Right here. Push. You felt that? It went in. You see this? There's enough blood there. So I'm going to start below and work my way up from the bottom, and like that. You heard the beep. We'll set this aside and let it work its magic. And I like to put this in that. And now we'll put